I wanted to inform you about a new government initiative about dying, and whilst it's not as far-reaching or is likely to be that impactful on everything, I think it's a good initiative because it is encouraging health professionals and those involved in death and dying in a professional sense and in a personal sense to talk about it more, to make it more part of our lives rather than avoiding it. I'll put a link to it in the sidebar anyway, but I mean, one of the things that struck me very strongly was that in a hospital, dying and the concept of dying, or discussing the notion of dying and what it might imply, is absolutely strenuously avoided by doctors, I guess because it's seen as a failure on their part. Their job is to maintain life, whereas in a hospice suddenly you get to talk about it in a totally different way. And one of this kind of initiative had already begun when I was sort of directly involved with the hospice, a hospice. They were pulling in medical staff from the general hospital to do a chunk of time, a couple of weeks each, I believe, in that field, so that they had a better understanding of death and dying. It's not part of their training at all, so they are becoming more informed and very interested. I was asked quite a few questions by one of the medics who was in there doing that. But anyway, this initiative is called Dying Matters, and it actually says, let's talk about it. Now I am the proud owner of a certificate saying that I am a member of the Dying Matters Coalition. Now, exactly what that means is not immediately easy to tell, but they have, if you join it, they have a newsletter. I don't know if you can join it outside Britain. I don't see any reason why not. But you know, it's quite comprehensive. The website looks on the surface to be very superficial and not to give much information, but if you rummage, there's actually quite a lot of stuff you can download in PDF format. And I think it's going to evolve. It's very early days. The links and what have you were only starting to be set up in, I think it was November, December time, so early days. And I know it might not apparently be relevant to people in countries other than Britain, but in a way it is, because I think this needs to happen, not just in society, but particularly amongst healthcare professionals, because the avoidance of it and their fear of it really is a huge stumbling block. It says on here, working to support changing knowledge, attitudes and behaviours towards death, dying and bereavement, and through this to make living and dying well the norm. I mean, it's a bit of a catchphrase, isn't it? But nonetheless, I thought it was worth sharing with you because I'm pleased that is happening. And if anything else crops up as a result of it, I will let you know.